I know. Yeah.
Everybody, thank you for coming. I'm so excited. As probably some of us have done, I know I've traveled really far before to do this sort of thing in other communities, so I'm really happy that we could do it here. And thanks to Shelly, because Shelly brings to light that we have big problems with overpopulation right in our backyard, and that there's animals suffering. And there's pet overpopulation, so I'm really glad that we can do this. And also, even if people aren't cat lovers, this is a good thing for the environment, because the impact that 22,000 cats has on the wildlife is pretty significant. My voice is not so awesome today. I'm Dr. Renee Ferguson. This is Dr. Cherise Sackles from Canada West, who is also, she is a veterinary surgeon specialist, and she's volunteered her day to come, which we totally appreciate. So thank you, and we're I'm looking forward to giving you the hard cases.
We made sure you catch some really good ones.
You got to give all 5. Yeah. What you wish for.
So she's was nanosurgeon.
Yay!
So.
And this is Dr. Anita Glups.
We can all take a minute.
This is Dr. Anita Glups, and she works at Mountain View. And she told Shelly we could do 60 in a day.
Oh, so, I think that's
and then we have Kim, or Kimsies. And then we have Kim, or Kimsies, and
she's Captain Starfish. Is her new name.
Okay. Angie, who's this is Sarah. Sarah is a VOA that's at our practice. She's going to be in charge of our equipment. So I have about 8 skeleton packs, usually about packs with like a ton of instruments. Like, hopefully we can do that. There are other instruments that are autoclaves and bombs, mayos, and all those sorts of things. At the moment, like 8 spay packs. So Sarah, so that's why it was great that people donated towels, because we can use our, but we do just have like essentially at the moment like 8 spay packs. So Sarah is going to be rocking the autoclave and the wash machine. So that's why it was great that people donated towels, because we can use our wash machine and our resources to do surgical laundry, so that we can get sterile packs and instruments going. So that's great. So if you think you need instruments, Sarah is going to be driving that machine. Juanita is an RVT that works with us. Super capable, been probably RVT for about 20 years. And Teresa, another one of our RVTs, super capable. I've taken her into lots of crazy situations, and she stays totally calm, and she's awesome. Robin, our practice manager, she knows where everything is in the practice. And Jamie is a future vet of like 2020. One of the hardest working students I've ever met. So, and then we're going to get another RVT as soon as she has a nap, because she did the night shift at Animal Emerge at the Fraser Valley. So she's going to go home, have a quick nap.
That's Cassidy and Sky's tech that took care of them overnight.
So she's going to go have a nap, and she's going to come. So we'll have another RVT, which will be amazing. And we're going to also have 2 more vets come from Northwest Nuclear Medicine to basically, they're going to help us. They don't do as much surgery, but they're certainly capable of lots of things, and wrestling hyperthyroid cats, so they can help us with feral cats, and recovery and induction and all those sorts of things. So thanks. I think it's great. What, Shelly, and you can talk of what I think, so we have 13 spays to do. One of the spays needs probably an inoculation. There's one neuter that probably needs an inoculation. We'll have 2 tables sort of going with neutering and prepping to feed this, because we will probably be able to get through neuters and stuff before the spays and the inoculations. And then who's ever in here, maybe Teresa, I'll put you in there with Dr. Sackles. Give us like the heads up enough so that we can get another animal ready for you, and then we'll have it ready, tattooed. There are sheets on there. What our plan was, and when we've done TNRs before, we've pre-meted them all, and Nita and I have talked about this, and it's worked well. If they've all gotten like Kitty Magic, like dextromethorphan, ketamine, and terbijuzic. And then what we do is they all get sub-Q fluids. We found, initially we had done some IV fluids. If you want somebody specifically on IV fluids, we can do that. Our regular patients that are TNR all go on IV fluids, but we found they're on IV fluids for like this amount of time. They wake up and they're mad, and we've pre-meted them all, and Nita and I have talked about this, and it's worked well. If they've all gotten like Kitty Magic, like dextromethorphan, ketamine, and terbijuzic. And then what we do is they all get sub-Q fluids. We found, initially we had done some IV fluids. If you want somebody specifically on IV fluids, we can do that. Our regular patients that are TNR all go on IV fluids, but we found they're on IV fluids for like this amount of time. They wake up and they're mad, and they've had like 2 meals of fluids or 6 meals of fluids. So we're better to give them 100 because they probably didn't drink last night. And then we give them transmucosal buprenorphine and Metacam before and then we put them back in their kennels. They seem to do well in there. And we'll have somebody, I'm hoping when the other vets come to, that don't do as much surgery, because we're going to have like a recovery room over there, and they can just make sure and keep an eye on everybody. So we'll have sort of an in room and an out room. So let me just go what I did on my list. And we'll have somebody in each team responsible for the paperwork, because I do want to keep track of the tattoos. We're going to tip their They can probably go to your house.
Yeah, we're
we're
gonna
taking
keep
this guy home
Calvin.
for sure.
We're gonna keep Mason. We'll keep anyone that you think would benefit from extended care or pain meds.
Yeah.
Or whatever.
Yeah, because I was looking at it. So.
What about ones like that? Are we giving them convenience?
Absolutely.
Oh, okay.
No, I think as long as you guys feel
that looks
comfortable.
pretty, yeah.
I think, abscesses and stuff like that, I think, I don't have any problems giving convenient for there. I think and then Shelly doesn't have to go and try to medicate them.
Yeah, that would be tricky.
I mean, we like medicating them, but one less is good.
Do you have like ideas or inputs? Is that
sounds good.
That sounds okay? Okay. Okay. And as far as maybe what I was going to do with my phone, if it's okay, or if one of you, Robin, if you can just take a picture of her suture cupboard, as far as just logging what supplies we're using, so you don't have to, no one has to count what supplies. We'll just say what we had, and then we'll look at what we don't have by the end of the day, and then we can log the suture packs and stuff, and I'll show you where stuff is. Okay. Cool. And so we don't have to get totally carried away with that. We can always estimate also it would be. And there's caps and masks and stuff like that. What we did with the first round of the spay packs is we took paper drapes so that we could simply just chuck them out after. And then probably with your next round, when she does, we'll put, because usually we do washable cloth drapes, or things like that, just so that will help us with our
I do have a whole bunch of extra up in the cupboard too.
of extra drapes.
Yeah.
So I just sort of estimated what a spay drape would be, and I cut it out in that fashion.
So they're super fancy.
So they're very fancy paper drapes, so that I thought
She
that
said
was
them last night.
just a little bit less work on Sarah's part. But if you're not happy, we can whip other drapes or equipment out at any time. Good? Okay. And Angie, through donations and through Angie's hard work, there are snacks and water and Starbucks coffee in the back. So, and then there's lunch coming later too, right?
Yeah, hot lunch, soup and sandwiches will be delivered by me closer to lunchtime. But if you want anything from the outside world, just ask, and we can have it. We can have it brought in. So there's lots of food coming at lunchtime.
Yeah. And if
And Luke and Leia, Farah and Justin's adopter is an RMT. She's coming around 3 to keep all the vets going and the techs going and all you guys that have been.
I know. And the techs were very excited about that. I was like, I don't think I'll be still enough.
I know,
I'm
Dr.
gonna get
was like,
all-
oh, that's, I don't know.
I can't stop.
And Shelly's like, I think you're
So, yeah, and so anything you guys just ask. My husband's coming too after little hockey practice. And he wants to just do whatever you guys need, whatever you need.
Matt wants to bring the estrogen level down a little bit. I did notice that they're all women here, everybody. Yeah, it's pretty awesome, all
Pretty
female
awesome.
vets.
That's
and
right.
It's pretty awesome.
Yeah.
You can borrow my headlamp if you want.
Oh, she had a really nice headlamp on last night, and I'm like, how did you get a nice headlamp? I would love that for dentistry.
It might have a lot that. I know, right? It's awesome. It probably has ear mics and ringworm on it.
And you just put it
on.
on.
I know. I'm gonna have
On your
to
Christmas list.
bleach bath myself.
Really?
I did clean it a little.
You did. It's okay. Thank you. So there are 3 animals currently pre-medded. We got 1 regular spay pre-medded, 1 cat, the neuter with the metacarpal. Is that on the front or the back?
Front.
Okay, yeah, with the metacarpal or whatever that is. And then 1 regular neuter, then 1 regular. Be the next round we'll do the nucleations because I thought just in case you were hung up or emergencies or do something fancy. I can do nucleation too. But I don't know, I maybe do like 5 a year, so I don't do a ton, but most of them, or probably half of them are for Shelly or for the other rescues with the ruptured eyeballs that come in, but awesome.
Who's the absence to?
Bradley.
Yeah.
It's an ear infection. I think.
So, I thought if we totally, and you can pipe in about this, if we totally, it gets to be like maybe 1 o'clock or something, and we've done, and because we just have 1 surgical room, there is a possibility we could have 2 tables running in there. I don't know, I've never done that. And have 2 sets of space going just so that we get them done. I don't know.
Kim and I can do one in the van.
You could do a spay in the van? I don't know. Have you ever done, like, shared a room and done 2 space? I don't know.
Not in a clinic, but I mean, I think that would work.
That could work.
for
So
sure.
we can sort of, if we find, you know what, that's where we're gonna need to.
Yeah.
But I think if we keep, and then feeding them in very efficiently, and I don't know, also, we can talk about if you want to stay sterile sometimes and just getting them and change gloves or re-scrub each time too. How many gowns do we have?
We have 6 gowns, I believe.
We have 6 gowns, so that's a good start, but, if it's possible, however you feel about staying sterile for some of them and then just getting fed them and changing passing gloves if it's, and depending, or we have another table we could move in and we have the 3 nice anesthetic machines. We could do them side by side. So just however you guys feel.
Yeah, they're not the.
Yeah. I'm probably about, depending on the space, probably about a 15-minute or depending on 20-minute or something. Probably you're the same. Yeah, having you is really going to help speed things up. Awesome. No pressure.
Yeah.
I never do space usually.
So, and you can see how yeah,
Don't like it.
too. And if you guys want breaks too. Because, I mean, you and I'm used to doing hundreds a year, so.
Breaks? Really?
Got breaks?
Well, I mean, everybody's got to pee.
We'll stick it in for you. You can bite it.
Everyone's got to pee.
We didn't pee yesterday. Can we keep? I know.
She just said she didn't.
I know I didn't. No water. Can we keep uteruses and testicles just to? It would be neat to do a comparison photo for the internet.
So you want them like laid on a piece of something?
Mm-hmm.
I think it's possible.
How do you feel about ovaryectomies?
I've never done them. I haven't done them because for pets. I don't do them because I think we can be open to it, especially for this situation because we don't have to counsel the pros and the cons to clients.
That's all I ever do anymore.
Oh, do you? Okay.
Oh,
So I'm open to it. Probably for me, the time difference when it's a pet is probably like this much difference.
Yeah.
But yeah, I'm open to it. I think that it's a good day to do
I only
that.
mention it because she says we gotta lay them all out, so mine are gonna look different.
Wait, you're gonna go midline?
Yeah, oh yeah.
Yeah, okay. As far as prepping goes? Okay. Yeah, I'm open to that.
What you bring your shoes after, I guess.
Yeah.
And does the recovery time differ between the two?
No.
French to me.
Sweet.
It's just a little less surgery.
Yeah.
A lower dose of surgery.
We have, I think, complicated uterus, well-used uteruses, so.
Oh, I see.
Yeah, not if they're, I mean, if there's some kind of pathology. in
Yeah,
the
yeah,
uterus,
no.
Definitely take it out, but if the uterus, I use uterus.
Yeah.
And these cats will probably never be complicated as far as needing to know whether there's a uterus in there,
Right.
because they're not going to get ultrasounded
Right.
looking for something in the future and going, what is this and why aren't those there? And
Right.
whereas
Yeah.
a pet, they'd be, I don't know. Okay, yeah, I'm open to that.
Cool.
You open to that?
Yeah.
Just like on the gate on either side of the.
I mean, I have talked to actually one of the vets that I have a travel buddy, and we go to Africa and do this every year, and I've tried to convince her to do it, and she's like, no, because she's in general practice, and she does space. Like, you guys do lots and lots and lots, and for her, it's not any faster.
Right.
I think it's faster, but it's what we're teaching at the school now.
Yeah.
Because if you start from the beginning, if that's your learning curve,
Right.
then it is, and it's just less surgery.
Right. Okay.
Sounds good to me. Cool.
And okay. Cool.
You were good.
You ever you like it on both sides?
For cats, I just pick it up. I usually tell the students like the technique, the little Halloween cotton ball with Kleenex over it. That's how I do cats because they have such tiny. Most cats are so tiny. They're so practice with them that if you pick up the ovary and then light everything all at once.
Both sides.
Yeah. Yeah.
I always think Kim's gonna do that.
Yeah, I do that for dogs because dogs have more tension on between the uterus and the pedicle, and so it tends to just do one, it tends to fall apart.
Yeah.
The cats.
You double just double like that.
Yeah. Well. Yeah. Sometimes. Okay. I usually single legate now, but I started at double.
Okay.
When you have double.
Yeah.
That'd be
Versus triple.
Yeah,
that'd be good.
if there's enough time.
Yeah, absolutely. Good that way. Yeah, we good. Awesome. Cool.
The girls just gonna get the spade ready and then they'll pressure in their head, you know? Yeah. And then it's just kind of that weird, you know.
Yeah. Yeah.
Yeah, kind of quickly see each type of.
Yeah, I think for people who do a ton of them, especially for animals who go out and size is more critical, or most critical, you know, for ferals and stuff like that. Because you can center your incision a little bit over just the
Cranial.
ovaries.
Yeah.
Oh, sometimes to be honest, for cats, like some are tiny anyway.
Yeah, stand by.
For me, for the size of my finger to get in, because I use a spade hook, so
Yeah.
probably doesn't end up being that much difference, especially for cats, but
Yeah.
it is. Yeah.
I'm gonna lock the front door, okay, everybody?
Sounds good.
Did you teach at WCBM? Okay.
Yeah.
Okay, I'm gonna try doing another reset on a different internet and see if that lets us do better. So stand by, everyone.
When did you graduate?
1999.
Okay.